Imagine a life punctuated by sudden, debilitating episodes of fever, pain, and inflammation. This is the reality for millions of people around the world living with familial Mediterranean fever or FMF, a hereditary autoinflammatory disorder. FMF is often misdiagnosed, leading to years of uncertainty and unnecessary suffering. In this essay, we will delve into the intricacies of FMF, exploring its symptoms, diagnosis, and the crucial need for timely and accurate recognition. Join me as we shed light on this often misunderstood condition, empowering patients and healthcare providers alike to navigate its complexities. Familial Mediterranean fever, as its name suggests, primarily affects populations originating from the Mediterranean region. This includes individuals of Turkish, Armenian, Arab, and Jewish descent. It is a genetic disorder, meaning it is passed down through families. The culprit is a mutation in a gene called MEFV, which plays a role in regulating inflammation in the body. The consequences of this genetic glitch are significant. Instead of functioning normally, the immune system goes into overdrive, triggering episodes of intense inflammation in various parts of the body. These episodes, known as attacks, are the hallmark of FMF. Understanding the genetic basis of FMF is crucial for accurate diagnosis and effective management. Early diagnosis and treatment are paramount in mitigating the long-term consequences of FMF. By raising awareness and promoting a deeper understanding of this complex disorder, we can empower individuals to seek timely medical attention and lead healthier, more fulfilling lives. The symptoms of FMF can be diverse, often mimicking those of other common illnesses. This makes diagnosis challenging and highlights the need for heightened awareness among healthcare professionals. The most common symptom is recurrent fever, which can spike suddenly and last for a few days. Abdominal pain is another hallmark of FMF. This pain can be severe, mimicking appendicitis or other surgical emergencies. Chest pain, often sharp and piercing, can also occur due to inflammation of the lining of the lungs or heart. Joint pain, particularly in the knees, ankles, and hips, is another frequent complaint. While FMF predominantly affects those of Mediterranean descent, it is crucial to remember that genetic disorders do not adhere to geographical boundaries. Individuals from other ethnicities can also inherit FMF, albeit less commonly. Furthermore, the severity of the disease can vary widely even within the same family. Diagnosing familial Mediterranean fever can be a complex puzzle, often requiring a combination of clinical evaluation, genetic testing, and careful exclusion of other potential conditions. There is no single test that can definitively diagnose FMF, making the process reliant on a comprehensive approach. The first step typically involves a thorough medical history and physical examination. The doctor will ask about the patient's symptoms, their frequency, duration, and any triggers that seem to precede the attacks. Family history is also crucial, as FMF is hereditary. If a close relative has been diagnosed with FMF, the likelihood of the patient also having the condition increases significantly. Genetic testing is another important tool in diagnosing FMF. This involves analyzing the patient's DNA to look for mutations in the MEFV gene. While finding a mutation provides strong evidence for FMF, it's important to note that not all individuals with FMF will have identifiable mutations in this gene. In addition to genetic testing, doctors may order blood tests to look for markers of inflammation, such as elevated white blood cell count, erythrocyte sedimentation rate, and C-reactive protein. These markers tend to be elevated during FMF attacks and return to normal levels between episodes. The chameleon-like nature of familial Mediterranean fever often leads to misdiagnosis, as its symptoms can mimic a wide range of other conditions. This diagnostic dilemma can have significant consequences for patients, leading to unnecessary treatments, delays in appropriate care, and increased risk of complications. One of the most common misdiagnoses is acute appendicitis. The severe abdominal pain characteristic of FMF attacks can be easily mistaken for this surgical emergency, leading to unnecessary appendectomies. In fact, studies have shown that a significant percentage of individuals with FMF have undergone appendectomies before receiving a correct diagnosis. Another common misdiagnosis is inflammatory bowel disease, such as Crohn's disease or ulcerative colitis. The abdominal pain, diarrhea, and weight loss sometimes seen in FMF can overlap with symptoms of inflammatory bowel disease, leading to misdiagnosis and inappropriate treatment with steroids or other immunosuppressants. Rheumatic diseases, such as juvenile idiopathic arthritis, are also frequently mistaken for FMF. The joint pain and swelling that can occur during FMF attacks can mimic the symptoms of these conditions, leading to misdiagnosis and potentially harmful treatments. Misdiagnosing familial Mediterranean fever can have far-reaching consequences, impacting not only a patient's physical health but also their emotional well-being and quality of life. The delay in appropriate treatment can lead to a worsening of symptoms and an increased risk of developing serious complications. One of the most concerning complications of untreated FMF is amyloidosis. This condition occurs when a protein called amyloid builds up in organs and tissues, impairing their function. The kidneys are particularly vulnerable to amyloid deposition, which can eventually lead to kidney failure. Furthermore, the constant cycle of misdiagnosis and inappropriate treatment can take a toll on a patient's mental health. The uncertainty and frustration of not knowing what's wrong can lead to anxiety, depression, and a sense of isolation. The unpredictable nature of FMF attacks can also disrupt education, employment, and social activities, impacting a patient's overall quality of life. Despite the challenges in diagnosing and managing familial Mediterranean fever, there have been significant advancements in recent years, offering new hope for patients and their families. These advancements include improved genetic testing, a better understanding of the disease process, and the development of new and more effective treatments. One of the most notable advancements is the availability of more comprehensive genetic testing. In the past, genetic testing for FMF was limited to looking for a small number of common mutations in the MEFV gene. However, with advances in genetic sequencing technologies, it is now possible to analyze the entire gene, increasing the chances of identifying rare mutations that may be causing the disease. Another area of progress is the development of new medications for FMF. While colchicine remains the mainstay of treatment, effectively preventing attacks and reducing the risk of amyloidosis, some patients may not respond adequately to this medication or may experience intolerable side effects. For these individuals, new biologic therapies, such as interleukin-1 inhibitors, are showing promise in controlling symptoms and improving quality of life. In addition to these advancements, there is a growing emphasis on early diagnosis and treatment of FMF. Recognizing the potential for serious complications, healthcare providers are becoming more proactive in identifying and managing the disease, particularly in individuals of Mediterranean descent who present with recurrent fevers or other suggestive symptoms. While medical advancements offer hope for improved FMF care, bridging the knowledge gap among healthcare providers and families remains crucial. Early recognition of FMF is paramount for timely intervention and improved patient outcomes. Doctors should be vigilant in considering FMF as a potential diagnosis in patients, especially those of Mediterranean descent who present with recurrent episodes of fever, abdominal pain, chest pain, or joint pain. A detailed family history, including any relatives diagnosed with FMF or exhibiting similar symptoms, is essential. Families, too, play a vital role in early recognition. Educating themselves about FMF, its symptoms, and potential complications can empower them to advocate for their loved ones and seek prompt medical attention. The future for individuals with familial Mediterranean fever is brighter than ever before. With increased awareness, improved diagnostic tools, and effective treatment options, individuals with FMF can live full and active lives. Early diagnosis is the cornerstone of this positive outlook, as it allows for timely intervention and prevents or minimizes the risk of long-term complications. With proper management, individuals with FMF can experience significant improvements in their quality of life. Adhering to prescribed medications such as colchicine can significantly reduce the frequency and severity of attacks, allowing individuals to participate in daily activities without disruption. Regular monitoring by a healthcare provider experienced in managing FMF is essential to ensure that the treatment plan remains effective and to address any emerging concerns promptly. Familial Mediterranean fever, though often shrouded in a veil of misdiagnosis, is a manageable condition. By raising awareness among healthcare professionals and the public alike, we can empower individuals with FMF to receive timely diagnoses, appropriate treatment, and the support they need to lead fulfilling lives. This call to action extends beyond borders and cultures, as FMF affects individuals globally. Collaborative efforts involving medical professionals, researchers, patient advocacy groups, and policymakers are crucial to advance our understanding of FMF, improve diagnostic accuracy, and ensure access to effective treatments for all. Let us work together to unravel the complexities of FMF, transforming the lives of those affected by this often misunderstood condition.